So I'll just stop there and check whether people have got any questions around that part. Anybody typing? No, I'll go on then, and then we might have some questions at the end. Oops, wrong way. Okay, we need to recognise that practitioners and services need to become very, very well educated and understand that interplay between sex, gender, sexuality and sexual identity. To really spend time to understand the experiences of sexual abuse of the people they work with. Yes, it's really important to obtain good learning and literature and read in these areas, but that doesn't take away from sitting with somebody and listening to their experience and the particularities of that experience and working with them in a way about how they might help, how they might assist. In my practice, I'm very, very conscious of this, that in a sense, so often we can take a very expert position about knowing about what somebody needs to do or what the problems might be. We need to think about the fact, if we have not actually spent time to listen to this person's particular experience, however much knowledge we might have, it might be difficult to access that knowledge, for them to access that knowledge, if they haven't had a sense of somebody sitting with them and talking through the difficulties they've experienced. We need to be comfortable about talking about a variety of sexual acts and sexual preferences. We need to have done our own work and understand our own experiences and find ways to also look after and take care of ourselves in doing some of this work. I would say to people, do not visualize when somebody's telling you about a sexual experience. I know that's very hard to do because often people will record or remember through visualization. However, the difficulty is that putting those pictures in your head is not helpful for you or for your client. I reckon it's also important to provide accessible education material, recognizing that just because somebody is exposed to sex at a young age doesn't mean they know about good sex health and good sex education. And recognizing that you might have to link people in with other supports because they're not talking with anybody else about it. You have to go the extra few yards and meters or whatever in supporting those men. I also wanted to talk, and this is just the last couple of slides, recognizing, and because I often get asked questions around men's use of pornography and masturbation and around the experience of sexual abuse and how that might get hooked in and mixed up. When we're thinking about this, we do really need to think about this, the issue of pornography, masturbation, and then sexual activities or casual sex in the context of men's lives and not just through an abuse lens. We know that men are twice as likely as women to access internet porn. We know that men are much more likely to masturbate or express interest and participate in casual sex. The figures from that international study I've got here, it's just 3 points from the bottom. They are quite telling in the sense of it's a group of heterosexual men. 97.8% have accessed internet porn. In the past 6 months, 92%. In the last month, 82%. In the last week, 63%. And the last 24 hours, 26%. These are very, very high figures. We need to recognise that men start watching this material at a younger age than females, at 13 years on average. That they often watch porn alone, twice more likely than women to watch it alone. And they often masturbate while watching it, 48%. These are not men who have just experienced sexual abuse. These are the men in the general population. They also are twice as likely to be interested in diverse sexual practices other than straight same-sex sex or different-sex sex. And it's really important when we're talking with men to talk with them in knowing this context. However, to also recognise that accessing this stuff and masturbating or watching porn can in some way feel safe, where sexual abuse wasn't safe, where there isn't another person involved, there isn't nobody else, you're controlling the situation or feeling in control of the situation. So in some ways it can be a kind of taking care of yourself. However, it can also have the impact that it can become quite an addictive process. Don't forget, internet porn is a very addictive process and designed to be so. So it's also important to review that, because in some ways, sitting in a room alone with internet porn, where there's all the secrecy, highly sexually charged atmosphere, where there's both secrecy, anxiety, arousal, can have all the feeling of being sexually abused and can recreate that dynamic. And so that's quite a challenge for men. And people can just lose all sense of the time, they can disassociate and really struggle with this. So it's really important we talk about this stuff and check in with men about whether this is contributing to their lives or not. And I've put some questions there which review that process. I've also just put a little piece here right at the end about the 12-step program, because I know that's being utilized in relation to sex addiction and porn addiction. And recognize, and it's also used obviously for drink and drugs, recognizing that men who've experienced sexual abuse are 5 times more likely to be involved in drug misuse and excessive drinking. There's question step 4 and step 5 of that program produce significant problems with men who've been sexually abused. The idea of making a searching and fearless moral inventory of ourselves. If I've never actually spoken about my experience of sexual abuse and worked out responsibility for the person perpetrating and my own experience and what I did or did not do and my responsibility for that, if I look about admitting to God, to ourselves and to another in a kind of confessional way, and the exact nature of my wrongs, I could take ownership for something which is nothing to do with me. I could believe or continue to believe that I was in some way responsible for the abuse. And often I'm aware that a lot of men will check out of 12-step programs. Men who have been abused will check out in that sessions 4 and 5. And that workers do not understand how that dynamic can produce significant problems for those men who have experienced sexual abuse. And I'd like to thank you for listening in. I would like very much in the next 10-15 minutes for people to ask some questions. Please click on your microphone or post some questions and we can chat some more. Yeah. Sorry, I'm back. I can't believe that I answered everybody's questions, or that there's one area you want me to go back to. And I'm recognizing I haven't probably talked too much about prioritizing choice in here, and recognizing that in a very simplistic way, sexual abuse is taking away of choice. In all our work and all our conversations with people who've experienced abuse, it's really important that we prioritize choice. And that flows on into our understandings of sexual relations and support of people, in the sense that if we put aside these ideas of sexual categories and start thinking about that sex is a choice, and that what is of concern is that it's a mutual supportive, respectful, age-appropriate sexual relations, be it with a male or female, that is what is priority and that's what should be considered. And in doing that, we then notice where it isn't age appropriate, where it is harmful or hurtful, or there is threat or harm, and we don't get caught up with difficulties around identifying sexual categories, and we don't get caught up with the homophobia which silences many men. So I'm very interested to somebody to ask some questions, maybe about relationship difficulties, maybe internet porn, maybe about the whole idea of sexual identity, maybe about the experience of sexual abuse as a child and how an 8-year-old tries to make sense with the information they've got around the experience of sexual abuse, where they might feel very physically connected and aroused at times and even comforted. And yet later on, when they're 12, 13, realize and understand this is sexual abuse, and then try and make sense of it without talking to anybody else, and the difficulties and challenges that sets up for those young boys, and recognizing there's those young boys who are 13, 14, 15 who are trying to make sense or have a sexual encounter, and they're taken advantage of, and they're at that very moment very hooked up with the ideas of being strong and powerful and be able to take care of themselves, And in this process, it becomes a real barrier to them seeking assistance and support. So I'll stop talking again and ask people to pose some questions.
Yeah, Gary, Ken here. Look, I'm interested in the link you're making, because I think that our challenge for young boys particularly is how do we actually create a really healthy sexuality that's not based just pure on performance, that is actually based on, I guess what you're saying is around intimacy, and that we actually have a very wide definition of what sexuality is. Because I think it's still, if we look at pornography, it's very much framed as an active thing rather than actually, as you say, that ability to have intimate moments, which may lead to some physical, intimacy and stuff, or it may not. So I'm kind of interested in that kind of question about, is there any stuff with young boys who've been abused, particularly, where there has been, better education around sexuality, in that wider sense rather than just performance-based, and whether has there been any research done to some comparative issues around that?
That's a really good question, Ken. And I think it is an absolute challenge, because it's so complex in relation to intimacy and the whole idea of sex as performance, and the difficulties then that sets up for the guys around, having an emotionally engaged life and being emotionally connected with their bodies, because it's very difficult to have an experience of intimacy if you haven't got a sense of your own emotions and of making room, or having a capacity for a variety of emotions, and also having empathy and support for other people, which is not how many young boys are trained, particularly to interact with other young boys. The difficulty is, and I was talking with Patrick O'Leary, who's out of Southampton, and you and I know works in this area. The group of boys that I think that we are failing completely at this moment in time are those boys in the 13, 14, 15, 16 bracket. We're clearly identifying and providing some assistance to those younger boys. And in the 8, 9, 10, and where the child safety services are clearly identifying and providing some support there. It's in that group, the 13, 14, 15, who are least likely to come forward. It seems that they're the ones that stuff it down the most, who just try and get through, or who are interacting in the way of all they know, and they're very much out there and trying to let people know, but people are not identifying this or making room for this. So yes, it's the group that, in fact, they're probably the least literature and the least set of work with. At the moment, the men who are coming forward are in their 30s and 40s, and yet we are doing some assistance to younger boys. But that teenage group are the group that we failed, I think, really badly, and we actually need to start designing services to provide assistance and support to.